In fact, 170 countries have now come forward in a fantastic demonstration of international solidarity and cooperation to try and end the acute phase of the pandemic through the working together in the COVAX facility. This includes 78 what we call self-financing countries, but as well as 92 countries that would be eligible for assistance through the COVAX facility. India is certainly eligible, like all countries in the world, to be part of the COVAX facility, and discussions are ongoing in that regard. We, from our side, of course, would welcome very much the participation of India as a full member in the COVAX facility, both in terms of its extensive experience in vaccines, extensive experience in working together on the global scene in terms of childhood vaccination, other vaccines. India is an incredibly important player, and we're very much welcome to be part of the COVAX facility. At this point, as you will be aware, the COVAX facility is still evolving, and then the final dates actually for confirmation, final binding confirmation in terms of participation of the facility is on the 18th of September. So discussions and negotiations are still ongoing with a broad number of countries in that regard.
Dr. Swaminathan would like to add something?
Just to add to what Bruce said, I think India is in a unique situation because obviously of the very strong manufacturing capacity in addition to the large population that would need to be covered by vaccination program. So India is in discussions with the COVAX facility, is very much going to be part of the facility, both as a supplier of vaccine doses to the facility, but also as a recipient of vaccines. And as you know, the advantage of being part of the COVAX facility is that you have access to a very broad array of vaccine candidates, because the facility is investing in a large number of candidates, trying to accelerate both the development as well as manufacturing, so that you have at least a few winners in that pool, which would then obviously need to be scaled up and distributed equitably to countries across the world, whether they are self-financing and paying for their doses or whether they're receiving it through the global AMC facility. The other challenge that countries need to start thinking about now is how the delivery of these vaccines is going to happen. This is not a childhood vaccination campaign or immunization campaign. This is going to be very different. It's going to be vaccinating adults, certain high-risk groups and vulnerable groups, and this is going to be different from what's been done in the past. It's going to be a challenge for countries, particularly those with large populations. And so a lot of thinking is happening both at the global level as well as at the national level, with the National Vaccine Task Force that's been set up in many countries, including in India, to really think through these issues and start building and investing in the systems that are going to be needed, whether it's human resources, whether it's supply chain and cold chain, logistics, syringes and needles, the training, as well as the databases that would need to be put in place. So yes, I think we all have to learn from each other and help each other to develop those systems. So on the one hand, we have, of course, the vaccine doses that would need to be procured and distributed, but then how are they going to get to the right people within the country in a fair and equitable and ethical manner? Thanks.